I'm going to show a little bit about what our priority survey showed. And this was over 1,000 people, which is really nice. It just gives us a nice solid bunch of data. So one of the top questions we asked people was basically, out of a list of different priority areas, what do you want? What's most important? What are you most passionate about? What would you want to see action? It was a bit of an all-encompassing questions. In a landslide manner, people said, so almost 1 in 2 people said that preventing cancers was the most important thing to them. Close second, so, taking out almost 80% of all of the data there, was early detection of diagnosis, which is kind of, I guess, quite logical if we look at it from the perspective of people don't want to get cancer. So therefore, if they are going to get it, they want it earlier detection. And you see the vast difference in the percentage differences, with the third being only 9.16%, and that's screening for cancers. So definitely the vast majority was either preventing cancers or early detection. So this is just a little bit of context. I don't expect anyone to read this because it is messy and there's a million different things. But we asked our CanAct members what topics are the most important for government to be acting on. And as you can see here, most of the topics ranked very important. The two at the top that ranked not important at all were based on tobacco, or some of the tobacco issues that we raised, and that's including licensing fees for businesses that sell tobacco, as well as awareness campaigns for the harms of tobacco. But I'll give you a little bit more perspective on the top items of what people wanted governments really to act on. These are the top 4 areas. You'll see that 2 of them are related to bowel cancer. So that's the bowel cancer screening program and the awareness of that and promoting that to ensure earlier detection, and also reducing wait times between colonoscopies and a positive stool sample test. So that's again for earlier detection. So those two scored, 93, almost 94% of people said it was very important for the government to take action. And then also the other 2 was to eliminate cervical cancer through the programs that go on in New South Wales. And then the last one, actually it ranked in second, was to increase financial support for patients accessing care who live or operate out of regional or rural New South Wales. So they're the top 4 items that our community members believe the government should be acting on. So again, a bit of a messy snapshot here to show. Then the next question was the exact same set of data, but then what are people willing to act on? So on a personal level, and you'll see there it was, sign a petition, speak to your local MP, etc., etc. Most people were very willing to do most things, but interestingly enough, that second set of lines there from the top, 1 in 5 people said they were not willing at all to take action on the licensing fees for tobacco retail. So again, the standouts there is that the least priority items for people were things related to tobacco reform. Sorry. But again, a little bit of perspective on what people are really willing to act on. So you'll see that there is a bit of a marry up there between what people want governments to act on and what people are willing to act on. So the bowel cancer topics came up again, both of them. So the screening program and the reduction in wait times, as well as the improved financial support for regional New South Wales patients accessing care. And then the 2 new ones that didn't rank the highest on what government should do, but what people are willing to get involved in is to improve outcomes for patients and survivors by improving supportive care needs access. So that could be things like psychological care, social care, or practical support. And also removing barriers to access clinical trials was another important one that came up of what people are willing, or, they would be very willing to act on as well. So this was a bit of a hypothetical unicorn type question. We asked people, if you could solve one thing tomorrow that would reduce the impact of cancer, what would you solve? What would you do? The top 2 by absolute landslide was committing to the implementation of optimal care pathways in all different cancer settings within New South Wales, and protecting children from unhealthy food and drink advertising that causes overweightness and obesity. So you'll see there that 22, so over 1 in 5 people and almost 1 in 5 people noted one of these two as the top two things that, like, we only asked you could only pick one. These were the top two things. All other topics scored less than 10% in importance. And you'll see there on the right, they're the topics that came in third. So a vast difference between what people really want solved right now. Unsurprisingly, we asked people a question of, how important is the issue of cancer care inequalities? And 3 in 4 people said it's a very important issue. 21 in 5 were not sure, and there's only a very slight amount of people who said that it's not an important issue at all. So hopefully that wasn't surprising for us. Changing a little bit focus from kind of that perspective, we then went on to ask people to rank how they believe that the government managed cancer care during COVID-19. Very kind of interesting results when you look at it in perspective, that more than half of people were really unsure how it was managed. The question was basically worded, how well do you agree with this statement? It was strongly disagree to agree, and it was based on the wellness of what the government did. When you factor in that over half said they're unsure, 27% said they handled it really poorly, and almost 1 in 5 people said that they handled it really well. So, I mean, they're big results, but taking into consideration that over half are not sure, it puts a little bit of perspective on the other two figures as well, definitely. And a little bit of demographic type data just to kind of frame where our responses are coming from. You can see we've got a pretty even 50-50 split between metro and then regional and remote. So majority definitely like half major cities in metro, and then we only had that small proportion of rural or remote, but it gives us a good balance of data where our responses are coming from. And in terms of who are the respondents or what categories they fit, we had almost 1 in 2 people, either patients or survivors. Family and friends came in second at 35%. There was a small number of carers, but those others included people like Cancer Council volunteers, healthcare professionals, concerned citizens, you know, ex psychologists, ex social workers. So it was a kind of a mixed bag of people, definitely. So I guess kind of to wrap it up, I kind of thought, let's frame this. We had our peaks basically, and you'll notice that bowel cancer came up quite a lot. Those two figures there. So ensure people with bowel cancer were diagnosed as early as possible by funding awareness campaigns, and ensure early diagnosis by reducing wait times. These ranked heavily and highly in both what the government should be acting on, but in addition, what people were willing to act on. So there was a lot of support for those for those two. And then the regional access to cancer care by increasing financial support for those who were in regional New South Wales, again, ranked highly on both the spectrums of what people individually would be willing to do, and then what they think the government should be acting on as well. And, there are other topics as well that, either ranked highly on one spectrum or the other. So for this one, it was more of along the lines of what people think the government should be doing, not so much what people would be willing to take action on an individual scale. Over 90% of people believe that, the government should be eliminating cervical cancer by funding campaigns to promote access to screening. Including access to at-risk groups, including Aboriginal women and women from culturally and linguistically diverse backgrounds. Over 90% of people also believe that the government should be preventing people from getting skin cancer by ensuring people of all ages know how to protect themselves. What are people willing to act on that they don't believe is as much of the role of the government? Is to improve the quality of life of people affected by cancer through supportive care needs or supportive care services. Things like counselling, financial support, practical support. People were very willing to act on that themselves and get involved. They didn't think it was as much of the government's kind of role or responsibility. In the same way, ensuring access to everyone to cancer treatments by removing the barriers to support clinical trials and treatment trials was something that people were quite passionate about in terms of taking action for themselves, but not believing that the government should be doing the majority of the work there. So it was kind of some interesting perspectives. Interestingly enough, kind of one of the standout figures is optimal care pathways. It was the single biggest item that ranked of what people want solved tomorrow. So that kind of gives us a lot of insight into, you know, if people could click their fingers and something were to happen, integrating optimal care pathways in all of the different cancer settings within New South Wales, that almost 1 in 4 people said that that is really what they would solve tomorrow. So, people crave, I guess, the consistency of it all, but it also opens up a really interesting conversation for us.